Hello, everyone. Welcome to the Healthcare and ADA Inclusion of Persons with Disabilities webinar series. My name is Pam Williamson, and I am from the Southeast ADA Center. I am joined today by Emily Schumann from the Rocky Mountain ADA Center, and we are your co-moderators. This series of webinars is brought to you by the Pacific ADA Center on behalf of the ADA National Network. The ADA National Network is made up of 10 regional centers that are federally funded to provide training, technical assistance, and other information as needed on the Americans with Disabilities Act. You may reach your regional ADA center at 1-800-949-4232. Next slide. We do have captioning for today's webinar. The caption screen can be accessed by choosing the closed caption icon in the meeting control bar at the bottom of your screen. Next slide. This webinar series is intended to share issues and promising practices in healthcare accessibility for people with disabilities. The series covers topics including physical accessibility, effective communication, and reasonable modification of policy issues under the Americans with Disabilities Act. These webinars occur every other month on the fourth Thursday at 2:30 p.m. Eastern Time, 1:30 p.m. Central Time, 12:30 p.m. Mountain Time, and 11:30 a.m. Pacific Time. By being here with us today, you are on the list to receive notices for future webinars in this series. The notices go out 4 weeks before the next webinar and open the webinar for registration. In order to listen to today's webinar, if you do not have sound capabilities on your computer or prefer to listen by phone, please dial 669-900-9128 or 8656. The webinar ID is 890-9898-1795. Please note that this is not a toll-free number. At the conclusion of today's presentation, there will be an opportunity for everyone to ask questions. You may submit your questions using the chat area within the webinar platform by typing the questions in the chat area text box or pressing Alt-H and entering text in the chat area. If you are listening by phone and not logged into the webinar, you may ask questions by emailing them to adatech@adapacific.org. Now today's webinar, next slide. If you experience any technical difficulties today during the webinar, please send a private chat message to the host by typing in the chat window. Type your comment in the text box and enter. You may also use the keyboard Alt-H to access the chat box via keyboard keys. You may also email adatech@adapacific.org or call 510-831-6714. That's a voice and relay number. Now today's session is back by popular demand. We had this session for the first time last year, and folks were so excited about it, they asked us to bring it back again. So we are thrilled today to have TA specialists with us who will be able to answer your questions about sign language interpreters, other communication access, transferring patients, service animals, and other ADA and healthcare questions that are important to you. Today's speakers are Jan Garrett, who serves as the Deputy Director of the ADA programs for the Pacific ADA Center at the Public Health Institute. She has over 25 years of experience providing guidance and training on the ADA and other disability rights laws for businesses, state and local governments, architects, people with disabilities, and others. As a person with a lived experience of disability, Jan has a deeply personal understanding of why disability rights, civil rights are so important. Nancy Horton is the Associate Director of the Mid-Atlantic ADA Center, where she provides information and guidance to individuals with disabilities, employers, business operators, architects, and others. She also writes and edits a variety of articles and fact sheets on ADA topics and develops training materials for the center. She has worked in the disability field for more than 35 years. Her experience includes conducting site accessibility surveys, architectural plan reviews, and trainings on accessible design, employment issues, and effective communication requirements. Maggie Sims is the project manager for the Rocky Mountain ADA Center, and she specializes in outreach and providing information, technical guidance, and training on the Americans with Disabilities Act for the center's 6-state region. She joined the Rocky Mountain ADA Center in 1992 as an ADA information specialist with a deep interest in reducing communication barriers for those with hearing, speech, and visual losses. As an expert on the ADA and effective communication processes and skilled in sign language, Maggie also provides guidance on technical assistance calls focused on helping the Rocky Mountain ADA Centers region. And folks, I am excited to start off today with some questions that we received ahead of time. And so we're going to have these questions and then we will open it up to your questions. And again, as a reminder, you can type your questions in the chat at any time so that you can participate and get your questions in. Next slide, please. So today we're going to start out with some effective communication questions. And Maggie, that means you're up. So we're going to start with the first question.
Hi.
So let me read this question
Okay.
for everyone. So it says, a doctor called to inquire about an American Sign Language interpreter services for a patient appointment scheduled for the next day. Does the ADA require the interpreter to be in person, or is virtual interpreting acceptable?
Well, as many of the ADA questions are, it depends. And this is where planning is so important ahead of time. You want to be ready for whatever comes your way. A doctor can receive a request for an interpreter, and it could be the day before, it could be before that, but many times they're not prepared for it. And to me, this is the most important part, is don't wait until they call you the day before and ask for it. So, and we'll talk a little bit more about that. As far as requiring the interpreter to be in person or virtual, again, this is where it may depend. This is in planning for having this effective communication. This is where you want to communicate with the patient and discuss with them, first of all, what is their preference? And this will take into account, what kind of a appointment is this? Is it a basic appointment to take some blood work? Is it an appointment to start talking about new medications? So there is virtual interpreting, And it is a great technology, but it's not always the best. It's not always exactly what each individual needs. And that's why it's so important to speak to each patient. If the patient indicates that they prefer to have a live interpreter in person, then you want to work to provide that if at all possible. And sometimes the answers to these also depend on what kind of an entity that you are. If you are a state or local government, then you must provide the primary considerations of giving the request that the individual makes. And so if they say, I'd rather have an interpreter, then you should work for that. You can offer them virtual interpreting and see what they say about that. This tends to be kind of a difficult area, particularly in the medical field, about providing virtual interpreting. And there's many reasons for that. But again, this is so important to speak with the person, find out what they prefer, and then work. Sometimes what you can provide can be limited by how much time in advance you have the information, or even where your practice is located. Some smaller areas may not have access to a live interpreter on that short of a notice. And so many things to consider. And again, planning ahead of time. So it depends. Be sure to talk to the patient and find out what it is they need. In one of the resources that we have on here, there are some samples of kind of a questionnaire that you can provide. And I highly suggest that every medical facility use these. Just like you have to include HIPAA information, payment information, you might want to include this as well to say it's just a basic. Do you need assistance, a form of effective communication? What would that be? What is your preference? Things like that. And we've got a couple of good samples that you can look up and give you some ideas on how you can put that into your regular daily interactions with your patients. So it depends.
Thank you, Maggie. That was an excellent follow-up there. So, can we go to the next question, please? So, we talked about the patient, but what if the patient that the doctor is treating is not the person with the disability, but the companion or caregiver, such as a spouse, a child, family member, or friend, is deaf? So maybe you need to communicate with the husband who is deaf about his wife who is hearing and about her healthcare needs. Do you have to provide the interpreter, or does the doctor have to provide an interpreter for the family member?
The answer to that is yes. The effective communication part of the ADA applies to anyone that is utilizing your services, whether that is the companion. We've seen many times where maybe you have a wife who is hearing and is giving birth, and the husband is deaf and has requested an interpreter. And yes, again, the short answer is you have to provide that effective communication. Um, and what that effective communication is, that's where we go back to it depends. In many, many circumstances, it really is. A live interpreter is the most effective, but whoever is a part of this the patient group, so to speak, whoever will benefit and needs the information. Um, my husband has recently been in the hospital, and we're not deaf, but a lot of the information is given to me as the spouse, and I need that information. And so it would be the same if I were deaf or he were deaf. And so you want to be sure that that communication is effective for anyone that will have any kind of caregiving needs, medication, um, things that they need to know. So it's very, very important that they are included if they request that.
Thank you, Maggie. It's always important for us to understand the nuances of the law, and this is one of those.
Mhm.
So,
Very much.
all right, we have another question about effective communication. So, a doctor has asked, what would we need to have in place or available for patients who need a sign language interpreter? Would it be sufficient to find a service that could provide the services via internet, smartphone, or iPad? Or would we need to find someone to be available in person to interpreter? And if we have video remote interpreting for patients who are deaf, have we met our effective communication obligations? That's a lot of information to unpack there.
It is, but the answers are really connected. Um, One thing that I mentioned before about having something in place is you want to plan for this well before you get those calls and saying we need an interpreter. This is where the planning comes in. And is it sufficient to find a service that can provide the services via the internet, smartphone, iPad? So basically, the video remote interpreting. This technology is absolutely wonderful and has opened up so many doors for everyone. And the video relay interpreting is a great, great service, but it is not the end all. It is one form of providing effective communication. And so my answer is yes to all of this. You should have in place a way to determine what the patient needs. You should have in place the service to use video relay interpreting. This is something that you do have to sign up in advance. It is a for-fee service because you are getting interpreter services, but it's via the internet. And there are a list of things that have to be met technologically for this to be used. And sometimes this is a little difficult, quite frankly, especially if you're somebody like me who really does not understand technology. And so you've got to have this in place ahead of time. Would we need to find someone to be available in person to interpret? You need to have this also planned. You need to have contact. There are many, many interpretation companies across the country, and many of them are national, but then they also work on that local uh, area as well. And so these are all things that you have to get in touch with ahead of time, sign up for. And yes, you will be charged for these costs. And so they will ask for a way to make payment, because most of the time you're not going to be able to just call an interpreting service and say, we need somebody right away. You've got to be signed up and a part of their clientele. And we get this question a lot from medical facilities that, if we have VRI, isn't that enough? And it's a start. It's a beginning. It's sometimes it's best to look at it as really as an interim before you actually can get someone there who is live. There's a great organization called the National Association of the Deaf, NAD. That's NAD.org. And they have some really good guidances on particularly the video relay interpreting in medical settings. many, and maybe the majority of deaf individuals who rely on sign language, they are not able to actually effectively get all the information they need from the video interpreting. And, reasons for this is a live person is three-dimensional, and sign language is three-dimensional, if not more. I mean, you use your facial um, movements. It's just a language all its own. And so many times you may get a request. You may offer them, is video remote interpreting going to be effective for you? Give them the opportunity to say yes or no. They may say yes, and then during the appointment, they may have problems, and some of this can be because the technology is not set up correctly. There's not enough um, of the internet resources that you need. So it's not a simple yes no answer. And there are some really good uh, guidances on this on the nad.org site. And I really recommend, as a medical practice, whether hospital, private practice, to check those out and read what they say. They give what do they call it? Let me just look it up real quick. They call it a position statement. That's what I was trying to think of. They have a position statement, which is not a legal requirement, but it is an understanding of why many deaf individuals ask for what they ask for. In general, they are not just wanting to spend your money. They want to understand what's being said and the proper amounts of information, dosages of medications. It's just so critical, as we all know. And so if you get a chance, you can look up the NAD website, and I do have that direct email link as well. So yes, I think the answer is yes to all of those.
Well, Maggie, so can we go to the next slide, please? Maggie, is there any limitations to providing auxiliary aids and services? Are there times when they would not need to be provided?
And that's a great, great question. There are limitations under the ADA. Um, there's actually a couple of terminology that's used. One is if it is an undue burden to provide a particular auxiliary aid and service, and if it's also a fundamental alteration, and I'll talk about both of those. But these are significant. So in other words, it has to be, if you are going to claim that this is an undue burden for our office to provide, you have to base that. An undue burden, and I'll read that exactly, it just means it's a significant difficulty or expense. And whether an undue burden exists can vary from business to business or from state and local government to state and local government. And sometimes that can vary as well from one year to the next. We may be a brand new doctor's office and we're just starting out, and, we're just barely making our payroll. But what about next year? The ADA is an ongoing responsibility. And so, how do we prepare that in 5 years we can provide the requests that we have? So, it's ongoing. And even if it does tend to be an undue burden right now, then you still have then that obligation to provide effective communication. And if you can't provide it in the fashion that the person has requested, let's say you get a request again for an interpreter, and you look at your expenses, you look at your overall income, and not just this specific person's appointment, but again, your overall business is not based on just the one appointment, then you still need to look at then what is the next best thing. And this is again where you communicate back and forth with your individual. And I suggest being as open about it as you can to say, we have determined this is an undue burden. It's something we can't afford because it's going to harm our business. And this is a large or a very broad responsibility to determine for it to be called an undue burden. It's not just, oh gosh, this is actually going to cost more than the cost of the appointment. That's not necessarily an undue burden. So don't use that. Um, and so if that's not workable for you, then you still have to find another way to be able to effectively communicate with that individual. And the only person that really can tell you that is going to be that individual. And this can be difficult, quite frankly, because many individuals depend on sign language, and that is their language. It's not English, it's not the written word. It's its own language. So, and I emphasize that so that especially in the medical profession, that people understand why this is so critical to provide the communication of choice. It's not just by choice; it's by necessity. Um, Another thing too, a couple of things under a state and local government. If you are looking into whether this is an undue financial or administrative burden, you have to take into consideration the cost of the particular aid or service in light of all resources that are available to the program, the service, or activity, and the effect on other expenses or operations. So again, it's a big it's important to look at all of this, not just the one situation. The decision, and this is really important, the decision that a particular aid or service would result in an undue burden must be made by a high level official, no lower than a department head, and must include a written statement of the reasons for reaching that conclusion. So, this indicates that this is not just off the top of my head. No, we don't provide interpreters. Sorry, we can't do it. Don't make that mistake. That can get you into trouble. That's state and local governments. If you're a private business, it's a little bit different. In determining whether a particular aid or service would result in an undue burden, you would need to take into consideration the nature and the cost of the aid or service relative to the size of your business, overall financial resources, and overall expenses. So, in general, a business or nonprofit with greater resources is going to be expected to do more than possibly a small business with a lot fewer resources. Sometimes a nonprofit could be in that position where their resources are limited. That doesn't mean that they lose the responsibility, though, to provide effective communication. But they want to look, do they have a parent company? What are the administrative and financial relationships? What is the size, the expenses? All of that needs to be considered. And for a Title II, again, state and local government, you are required to give primary consideration to the request of the individual. And that means unless you can show that this is going to be an undue burden or it's a fundamental alteration of the services that you provide, you need to provide what has been requested. For businesses and nonprofits, it's recommended that you consider the primary request, but then making that determination based on your business and what you know is available. Keep in mind again that we're almost 35 years. Next month will be 35 years of the ADA anniversary. And it, these are all things that we should know about already and already have planned and made provisions for. So whether it's, for a nonprofit, maybe they have to ask for specific grants to provide this communication, or, like any other costs, we have to put that into our plan, our budgets. And this is considered very important. As to the second question, can we ever charge the patient for the cost of the sign language interpreter services? The answer is no. You cannot charge them. Um, there are there are what I would call nuances to that. I mean, sometimes a deaf individual, even though we're required to provide, the business is required to provide the effective communication, sometimes a deaf individual has volunteered to say, well, I will, my husband, my wife, in this case, I could ask them to interpret, but that has to be completely and totally voluntary. Um, but otherwise, you cannot add that cost to the cost, to the charge to the patient.
Maggie, thank you for explaining that so well. And right now, what we're going to do is provide all of you with a few resources, and then we will uh, go into our next topic. We have an effective communication fact sheet from the ADA National Network. The U.S. Department has a fact sheet communicating effectively with people with disabilities. An ADA business brief, also from the U.S. Department of Justice, that's specific to communicating with people who are deaf or hard of hearing in hospital settings. Next slide. So we also have the ADA Title II Action Guide, Effective Communication from the ADA National Network, a settlement agreement between the U.S. Department of Justice and Kent Hospital, and then another settlement agreement between the United States and Adventist Health System in Georgia. So I
Pam,
highly
could
encourage you to take a look at these resources. And yes, Maggie.
I just wanted to mention, I had mentioned earlier that there were some good examples of questionnaires that could be used. And the two settlement agreements, the reason I included them is the Department of Justice, who was the enforcing agency, included those questionnaires. And they're easy to understand, pretty brief. And so I just wanted to point that if you're interested in looking at those, you can go to those two settlement agreements to find those.
Thank you, Maggie. So,
Mhm.
all right. Well, let's move on to our next set of questions that we received prior to the webinar. So we're going to talk about reasonable modification to policies, practices, and procedures. And so we'll go to our first question. A person with a learning disability is having a medical procedure. They ask the doctor to record the conversation about the procedure. The doctor's office states that they have a policy against recording. Is this a reasonable modification of policy? And Nancy, I'm going to turn to you to answer that question.
Thanks, Pam. Well, it's certainly a request for a reasonable modification of policy. Without really understanding why the office has this policy, it's a little hard for us to really definitively answer this question in the abstract. But it's certainly hard to imagine why it wouldn't be a reasonable thing for the practice to do, to simply provide. We're sort of assuming here that the person needs an audible version of these instructions or this information. And I think, recording a conversation or recording something might be a doable thing for the practice to do. But again, I think as Maggie mentioned, it's really important sometimes for the folks in this situation to interact with each other and really understand why is the person asking for what they're asking for, what are their needs, so that they can figure out how to meet those needs most effectively and most efficiently.
And this brings up a good point, Nancy, in that, maybe recording is not the answer, but maybe there's another solution, and having that conversation may bring up another solution that will make it effective.
Yes, sometimes if folks, have those conversations, people have different ideas that maybe somebody didn't think of, and they often can come up with solutions to these kinds of situations when they have those conversations.
Great, great. So, all right. So let's move on to our next question. So, in this scenario, a person has dyslexia and is unable to read well. They requested the brochures about their condition in an audio recording format. What are the ADA requirements?
Well, honestly, this is sort of similar. It's a similar situation. It's somebody who's kind of saying, you have this printed information, this written information, and that's not very accessible for me. Could you record it? Again, this sounds like it would likely be reasonable. It's apparently information that's already written down, printed somewhere, and they're just asking for somebody to read it into a recording so that that information can be more accessible to them. So I think it's a very similar situation.
So, and a lot of folks think that this might have fall under effective communication, but effective communication only applies to people who are blind or visually impaired, deaf or hard of hearing, or have a speech impairment. So that's why this is under reasonable modification. And folks who have other disabilities, such as dyslexia, may also need information. So,
Absolutely. Absolutely. Sometimes we would do very similar things for people with different types of disabilities, and they might be sort of categorized in different ways under the framework of the ADA and its regulations. And so at the end of the day, sometimes in the real world, those technicalities don't matter a lot to people, unless maybe you're going into court and you want to make sure that you're referencing the appropriate technical things, sections and all that sort of thing. But really, the principles are similar. It's in so many cases, it's about really trying to meet the specific needs of individuals with disabilities so that they can participate and get the benefits of services with equity.
exactly. And we've got someone that's asked, is it okay to guide the person to the website and have the tech read it to them? So that may be an option.
It could be an option. I mean, again, offering an idea, there's nothing wrong with that. Um, if somebody says, well, I don't have access to that, or, you know, but
Right.
yeah, as Maggie said, technology has really opened a lot of doors for options for all kinds of things, particularly when it comes to communication. Sometimes new technologies put up new barriers for people with disabilities, and then we have new barriers that we have to address with technology. But on the other hand, sometimes it gives us more options.
So very good.
And could I just add to Nancy's excellent responses that the key to all of this, whether it's the effective communication or the reasonable modifications, is communication. So yeah, I mean, there's no limit to what can be provided. Sometimes we get a question, well, is this reasonable, or is this and is this effective? And we can't answer that, but what we can say is just be open to just about anything. There's no limits to what can be used as an auxiliary aid or a modification. It's all about what can be done, reasonably for everybody and effectively for the individual.
So it's all about the creative thinking that we can bring there. And as Nancy said, to do it equitably. So, all right, well, we've got a couple of resources to share with you on reasonable modification. The ADA National Network has a healthcare and ADA fact sheet. The Mid-Atlantic ADA Center has Adjusting for Access, Reasonable Modifications in Policies, Practices, and Procedures. And then the U.S. Department of Health and Human Services has a whole web page and part of their website dedicated to discrimination on the basis of disability. So, all right, let's move into our next topic. So it's always one of our favorites, and that's service animals. So, all right, let's go to the first question. So a patient brought a dog into our medical office. How do we know if it is a service animal or just the patient's pet? Nancy, so can you take that question for us?
I'm back. Yeah, certainly. Well, both Title II and Title III of the ADA give us some very specific instructions on exactly what we can do in a situation like this. We can ask the person a couple of questions. Two, specifically. We can ask if it's a service animal needed because of a disability, and that's really a yes or no question. And if the answer is yes to that question, then we can ask what work or task has the dog been trained to do? And the person should be able to answer that question. And answers are usually things like it retrieves things for me, it alerts me to things, it guides me, it reminds me, things of that nature, tasks that the animal does. And if the person answers these questions, then we say, well, that's a service animal, and we move on. And assuming that there are no behaviors or obvious health issues or anything of that nature, then that's how we address that. There may be times, I don't know, maybe we have a question about this, but there may be times in certain very limited situations where animals could be excluded from certain areas in healthcare facilities, in medical facilities, but that's not the most common scenario.
Oh. Well, actually, this leads us nicely into our next question. When you were talking about maybe a dog that's out of control. If we can go to the next slide, please. So a patient recently brought a dog that they said was a service animal into the medical clinic, but the dog was barking, pulling on its leash, trying to sniff other patients and staff. So, and do you have to allow animals who behave this way to remain in the clinic with their owner?
Not necessarily. They shouldn't be sniffing, staff or snacks. In some cases, behavior is relatively minor, and an individual should be maybe given an opportunity to bring that animal under control. If the animal is maybe, again, sniffing other people or just trying to make friends or something, that's inappropriate. But they're not biting and snarling and growling, and in some cases a person should be given that opportunity to gain control of that animal. But if an animal is really cannot be controlled, even if it's not doing something dangerous, but it's just not under control, the person can be asked to remove the animal from the premises. The person can come without the animal, so that they can get the services that they came there for. But if they can't control the animal, they can be asked to remove the animal.
So the key here is the fact that the animal must be under the handler's control, and that if the animal must be removed, the person must still be allowed to get services.
Yes, absolutely. I mean, the Department of Justice talks in their regulations about a lot about the issue of the responsibilities of service animal handlers. Generally, service animals should be on a leash or a tether or something. If they're not, if either the individual, because of their disability, is not able to handle a leash, or a leash would interfere with the service animal's ability to do its work, then they don't need to be on the leash, or they don't need to be on the leash during certain times, perhaps, but they still have to be under control. Whether the handler uses voice commands or signals, or the dog just knows what it's doing and is doing what it's supposed to be doing, but it has to be under control. It's the responsibility of service animal handlers to be in control of their animals. It's never anyone else's responsibility in a covered entity. People shouldn't be going into the hospital or for medical procedures or tests and expecting staff to supervise their animal or watch their animal or hold on to their animal while they're going into the MRI machine or something like that. It's the responsibility of the handler. If they know ahead of time they're going to need to be separated from their animal for a period of time or something, then the thing to do is to make arrangements ahead of time, bring somebody with you, leave the animal elsewhere or something, because it's always the handler's responsibility. And it's very important that service animals be under control. These are public spaces that we're talking about. So we all have to be considerate of each other and get along. And that includes, folks who are using service animals.
Great, thank you. Well, the good news is we've already answered the next question, so we're going to go on to resources. And the U.S. Department of Justice has a frequently asked questions about service animals in the ADA. And the ADA National Network has service animal frequently asked questions and a service animal resource hub. All right, now we're going to go into our next topic on lifting and transferring. This is a very much debated topic in medical circles. So we're going to talk about these questions. And the first question is, are medical staff required to assist patients who need help with transferring onto medical equipment? Are they required to fully lift patients? And Jan, I believe this goes to you.
Okay, happy to answer this. So the short answer is yes, medical staff are required to assist patients who need help with transferring onto medical equipment. In terms of lifting, there are many ways that medical staff can assist patients with transfers. You can have a Hoyer lift, which is generally like a portable lift that's on wheels that can move around, and the person then gets placed in a sling type of device that can, and then they can be safely moved from their wheelchair onto a transfer and onto an exam table. You can also have, there are gurneys that adjust height. And so you can have somebody get to transfer onto a gurney at the lower height that's more at their wheelchair height. And then you can raise the gurney up and allow them to transfer over to the exam table or medical equipment, whatever medical equipment it is. But yes, the staff has to be prepared to be able to transfer the person, and like everything else, needs to probably know this in advance, have a question about whether or not someone's going to need assistance and be prepared to provide that assistance, and also listen to the patient. it's very important that you listen to how people say is the best and the safest way to transfer them or help them transfer, because you can actually injure the patient with the disability, and you can injure your staff by not doing this the right way. So be sure that you are listening to the patient's instructions. Be sure you are prepared in advance, that you have some other equipment, and if possible, having adjustable exam tables would really be, you know, an excellent thing, because mostly people are transferring to exam tables or dental chairs, and having those kinds of tables or chairs adjust in height would be the best. And even just having, you know, one or two of those, and being able to then know whose appointment is needed to have that equipment, and make sure that they are given that equipment in that exam room that they need. But if you don't have an adjustable exam table or other adjustable equipment, make sure you have a Hoyer lift, make sure you have maybe a gurney that can adjust to different heights. Figure out ways to be able to do it, and have your staff help without hurting their backs or themselves.
Jan, I love the fact you talked about accessible exam tables, because my mother is older and now uses a wheelchair, and we found an office that had accessible exam tables not too long ago, and we both loved it, and it saved everyone's back.
Yeah, they have some really good adjustable exam tables now, and sometimes the table is a scale. It can weigh you, so you don't need to have a scale in addition to the exam table. So there's many new kinds of equipment that are coming out, and there's some requirements for equipment for state and local governments to have, as far as you know, medical diagnostic equipment, but those are not yet at the moment required for private medical offices. But regardless of that, the private medical offices also have to provide reasonable modification of policy, and making sure that they're not discriminating against people with disabilities who come to them. So they still need to provide other ways, even if they don't have those accessible medical diagnostic equipment.
So very good, very good. So, well, we're actually very fortunate in that the Department of Justice has provided some instructive settlement agreements about this issue. And if you'll take us to the next slide, please. So these settlement agreements have some often include some similar requirements for healthcare providers. And an example is some of the things that Jan has already mentioned of obtaining, using, or maintaining accessible equipment. So providing assistance for transferring to and from diagnostic equipment, training staff on providing assistance and interacting with patients with disabilities. And when making appointments, make sure that staff ask patients if they will need accessible facilities, equipment, or assistance, and make sure you're posting notices of these policies. Next slide, please. And we have provided 4 of these settlement agreement examples to you. So we encourage you to take a look at those on your own, and to get some more information about what those agreements say and how to be able to get to the point so you are able to assist patients with disabilities. So next slide. And we also have some other resources on the U.S. Department of Justice has an access to medical care for individuals with mobility disabilities, and the ADA National Network has accessible medical diagnostic equipment. All right, we have one more, couple of more questions here, and then we are going to open it up to your questions. So these questions are on facility accessibility. And so we have a person that stated that the doctor's office does not have equipment designed for individuals who use wheelchairs, and she has not received the treatment that she needs. Our doctor's office is required to have equipment designed for wheelchairs. So this segues nicely with our other question. Jan?
Yes, it does. So yes, the doctor's office should have some kind of equipment that are usable, equipment that is usable for people who use wheelchairs. They should be making sure that they're providing an accessible route throughout their office, that there's a place to transfer next to the accessible equipment from their wheelchair. And imagine not being able to receive the treatment that you need. For example, not being able to have dental work or even dental cleanings done, not being able to, for a woman to have gynecological examinations to check for cancer, or, other, men to be able to check for other kinds of serious diseases. So it's really a very, very unfair and kind of blatant form of discrimination that you don't have the ability for people who use wheelchairs or have other disabilities to be able to provide that care and that equipment so that they can be checked and receive the prophylactic, the care that prevents other diseases and illnesses, because it's obviously much cheaper and much easier on the patient and the person to be able to prevent disease and see it coming early than it is to actually have something that comes much later. So I certainly have experienced myself and talked to other people where, they haven't had a dental exam in years. They haven't had other kinds of physical exams in years because they weren't able to transfer to medical equipment. And that is really just blatant discrimination, as is very, very unsafe and really does not meet the whole medical, the medical thing of do no harm. You really should do no harm to people with and without disabilities if you're in healthcare.
Thank you, Jan. And this leads into our last question. So, a person who is a wheelchair user was referred to a medical specialist office. Upon arrival, they realized that there was no access for their wheelchair, and the office refused to see them and told them to go elsewhere. What are this person's rights?
Well, kind of similarly to what we were discussing earlier, if it's a private healthcare facility covered under ADA Title III, if it's a new facility, newly constructed facility, it really should meet all the accessibility requirements. It may also be a facility that's had alterations, and those alterations or modifications should meet all the accessibility requirements. But if it is a facility that was built before the ADA came into play, in other words, before 35 years ago, because we're coming up on the 35th anniversary of the ADA, then if it's a private facility covered under ADA Title III, it has to remove barriers that are readily achievable. And that's easily accomplishable without much difficulty or expense. So things like, moving equipment around to allow an accessible route, changing doorknobs to lever handles, ramping a step or two at the front of the building, doing things that are readily achievable, easily accomplishable without much difficulty or expense. And really, these offices, private offices, should already be planning to remove these barriers and removing them and making their office as accessible as possible. Then if you're a state or local government, you have to provide what's called program accessibility. So the program would include the medical services that you are providing at a medical office or at a hospital. And so you need to, even at a medical specialist office, provide that accessibility as part of the program access of your facility. So regardless of whether your facility was built before the ADA came into effect or after, facility accessibility is really required and is so very important, particularly in medical facilities and including specialist offices. And a doctor should never have to refer somebody and tell them to go elsewhere simply because their facility is not accessible. It really is, they really are required to remove those barriers, make those healthcare services accessible.
All right. So, Well, let's go into the resources, and then we're going to open it up to questions from the audience. Some resources for facility accessibility are the U.S. Department of Justice's Access to Medical Care for Individuals with Mobility Disabilities. The Centers for Medicare and Medicaid Services has increasing the facility accessibility of healthcare facilities. And then the U.S. Department of Justice has the accessibility of medical diagnostic equipment used by state and local governments. All right, at this time, so we are going to open it up. And Emily, I'm going to turn it over to you to ask the questions, and we'll have Maggie, Jan, and Nancy jump in to answer.
Absolutely. So I've been collecting some good questions for you all. We'll start with a couple of questions for Maggie. Somebody asked, in a hospital setting, if a patient is deaf but does not use ASL to communicate, but they've been offered other ADA compliant auxiliary aids like CART services, oral transliterators, etc., but they insist on using a speech to text app that captions what's being said. Is this okay? Even when the patient is told that there could be errors in the speech to text, the patient is insistent on using the app and has been made aware that they reserve the right to change their mind at any time and can request a different auxiliary aid. Is this okay? And furthermore, are you aware of any such app that would be HIPAA compliant?
Absolutely. If the individual is saying that this will work, absolutely, I would go by what they are saying that they need, because they know best. You can always put into their file, document that, this was what we offered, this is what they requested, and this is what we used. And if they come back and say, well, that wasn't effective, maybe we need to look at something else, then you kind of go from there. But they really are, anything can be effective. I mean, each individual and their experience is so different. And again, not all individuals who are deaf use sign language. Many don't. Late deafened individuals, which usually means, someone like me, as I'm getting older, losing some of my abilities to hear clearly, sign language will never be my first language. And so captioning, things like that are more effective. And so, yes, I definitely would say if that's what they want, and it's not a burden to provide to do that. I don't personally know of an app. Maybe somebody in our audience can tell us, and send it in the chat, but or somebody else, but I don't know specifically of an app.
Great, thank you, Maggie. And next question is, how can you address the use of supported decision-making team members as an auxiliary aid for a patient with a communication disability attending medical appointments to help the disabled patient? Many offices respond to patients and auxiliary aid family members with, quote, "What is the ADA?"
And I wish I could say that's surprising to hear, but there's still so many professionals that are unaware of the ADA. And so the way the ADA works is it is a civil rights law. And what that means is you, as the individual or family member who needs those services, you are the educator. And so when they say, what is this? Be prepared to say, number one, it's the Americans with Disabilities Act. It's been in place for 35 years now, and it requires you that you provide the communication needs that we have in particular. And as we stated, anything can be a reasonable modification, such as a team. I forgot exactly what you called that, but the team working with an individual with a disability, that could be that could be effective communication, but it also can be a reasonable modification depending on what the disability is. And either way, as Kathy mentioned earlier, I'm sorry, as Nancy mentioned earlier, um, it's the whole purpose is to get what people need. And so it is certainly something that can be requested. And unless there is some reason to not provide it, I don't know if HIPAA would apply in this circumstance or not, but I know there are other things sometimes you have to look at. But you want to look at it, you want to investigate and determine, make a determination, not just pass it off. And if that doesn't, if there are some reasons for coming to the conclusion that this won't be reasonable, then look at what are some other options that we could do that would be more effective for the individual.
Great, thank you. And one more for you, Maggie, before we got some questions for the others. In regards to effective communication requests and reasonable modification requests under Title II, are local governments required to contact the person making the request as part of any determination?
I guess you would say it depends.
Mhm.
And I don't know if you're talking about getting in touch with them in regard to a specific request, or do you make the first step in asking people if they need communication accommodations or modifications? And there's answers for both of those. It's really important for Title II entities to ensure that they advertise and all their public information that they provide, that if you need a particular communication device or effective communication auxiliary aid, please let us know and give them a way to do that. You know, one of the problems that I think we see is many times government agencies have something on their website, but then you go to use it and it either isn't working or it doesn't have a specific person or office to get in touch with to request, say, an interpreter or braille or large print. And so that's really important. So did I answer? I think I answered two questions there. It depends on the situation. You want to be sure that you're advertising that these are available and give people the opportunity to request what they need. And then the second part of that would be that if you're not understanding what somebody needs, if they say, you know, I need an interpreter, um, that's really not enough information. And so at that point, yeah, you would want to get back to the individual to say, you know, what kind of interpreter. And of course, today that doesn't necessarily mean somebody who's deaf. It could be someone who speaks another language, which is also another part of the responsibilities of Title II agency. So hopefully that answers that question. If not, you can send me an email.
Thank you, Maggie. All right, the next set of questions came up for Nancy. Starting off, what are some modifications for PTSD or CPTSD? Are you aware of anything or a resource the person might turn to for that?
Well, I think in most cases, folks are going to be making requests based on their own personal needs. I often find myself saying, this sort of thing is not intended to be a menu. It's, people asking for very individualized, things based on their personal needs. So a person might ask a doctor's office, for example, to schedule a little extra time for their appointment or something like that. That could be an example of a reasonable policy modification because, maybe they typically allow 3 minutes, 10 minutes, something, I don't know, for their appointments. And maybe somebody feels like they're going to need 15 minutes or 20 minutes or something. So that could be a request. So I think it really, again, it depends. on what their needs are and what the situation is. That's another issue that we often find ourselves talking to people with disabilities or providers about those interactions when you're trying to figure out what people need, is sometimes when folks are making appointments or they're coming for appointments or things, they don't necessarily know exactly what that is going to look like, but the provider does. So sometimes the provider is they're going to have that conversation. They're going to have a phone call or something before the appointment, and they might say, well, this isn't what you seem to be expecting about this appointment. This is what we're going to be doing, or this is what we're going to be talking about, so that folks can have a better understanding of what the situation is that they're going to. And sometimes that can affect what they're asking for, whether it's a policy modification or maybe an effective communication issue, because what we need for those things is going to vary, even if we're talking about the same person, same doctor. We have different situations.
Yeah, absolutely. All right, and then we got a couple of service animal questions for you. So can you ask if the service animal is up to date on vaccines?
Generally, no. That's not something that most covered entities under Title II or Title III of the ADA are going to be in a position to do that. I mean, certainly most places have requirements for animals to be vaccinated, for dogs to be vaccinated, and that's fine. But the enforcement of that is going to be with that government agency that establishes that requirement. Not a doctor's office or something like that. Now, again, if somebody comes into a hospital or a medical practice or something with an animal that's clearly unhealthy, appears to be unhealthy, that's certainly something that can be addressed along with behavior issues.
Great. Somebody said, we heard from some of our clients that certain hospitals or clinics are renaming their rooms associated with the facility. For example, renaming patient rooms to call them treatment rooms, and then claiming that service animals are not allowed in treatment rooms. Have you experienced this, and what should people say in response?
I personally have not heard of that, but I mean, it doesn't really matter what you call it. It's really, what is it? I mean, and I don't know why a service dog wouldn't be allowed in a treatment room. Typically, that a treatment room is not, not something where you typically wouldn't be able to have a service animal accompanying a person. The areas where service animals can be really excluded from are really very narrow. A couple of examples related to healthcare are operating rooms. That shouldn't surprise any of us, right? You're not going to take your service animal into an operating room. A burn unit. Sterility is very, very important in those kinds of spaces. And even well-behaved, well-groomed service animals, in many cases, just not going to be appropriate in those spaces. But, a patient room, I'm assuming by that they mean, if you're going to stay overnight in a hospital, this is your room. That's not going to be a space where a service animal could be excluded. It doesn't really matter if you put a different name on it. So I guess they asked what their options would be. I think that's just, the usual options under the ADA. You could file a complaint. You could file a grievance if it were a public entity. You could file a lawsuit. You could, or do more informal things. You could try to talk to the folks in charge, the patient advocate, what have you. I always encourage folks to try to resolve things locally, informally, collaboratively, whenever that's possible.
Yeah. Last question for you, Nancy. Can religious institutions deny service animals?
Well, religious institutions are not covered by Title II or Title III of the ADA. So just talking about those titles. And so any hospital or something that's controlled by a religious entity is completely exempt from Title III. It's not going to be covered by all of these things that we're talking about now. Some of those types of entities receive federal funding, and so they would come under obligations that are triggered by the receipt of federal funding under Section 504 of the Rehabilitation Act. And that's a nice segue for us because it lets us mention that the U.S. Department of Health and Human Services, which is often a provider of federal funds to healthcare related agencies and businesses and so forth, just fairly recently updated their Section 504 regulations, and they're very closely aligned with the Department of Justice's regulations under the ADA. And they talk about service animals and accessible medical diagnostic equipment and all kinds of issues in those 504 regulations. So it's not uncommon for example, a religious hospital or something to be covered by Section 504. And so they would have very much the same obligations, but technically it's just not under the ADA.
I'm so glad you mentioned that, because somebody else had asked, if the provider receives federal funds, don't they have to be accessible?
Yes, the short answer is yes. That's an easy answer. I mean, what accessibility looks like, as I think we've touched on, could vary in terms of older buildings and newer buildings, and whether we're talking about policies and all these other issues. But they certainly would have the kinds of obligations that we've been talking about.
Great, thank you, Nancy. The next set of questions came up for Jan. I'm not quite sure how to help you with that. I set off my device. Okay, so Jan, the first question here is, we have a new facility. We are required to purchase an x-ray table that lowers to 17 to 19 inches. They don't make them. What is the next step?
Okay, an x-ray table, you said?
An x-ray table that lowers to 17 to 19 inches.
Okay, well, if you're a private facility, I think I heard, the regulations about medical diagnostic equipment don't apply. Those apply to state and local governments that are absolutely required to have a certain number and certain types of medical diagnostic equipment. But like I shared earlier, as a reasonable modification, you certainly should get as much medical diagnostic equipment as you can. Now, if they don't make a particular kind of medical diagnostic equipment, like an x-ray machine that lowers to a transfer height, then you're going to have to use those alternatives, like a Hoyer lift, like a gurney that maybe goes lower and goes higher. So I'm not really sure when they're saying that they're required to have this,
They clarified that they're a state prison.
Okay, so they're not a private entity. Okay, so they're a state prison. Yes, you're required as a state prison. You're covered under ADA Title II, and you are required to have certain types of medical diagnostic equipment that is accessible. And so if you cannot find one at that transfer height, then you're going to have to figure out other ways to be able to get people transferred onto that x-ray table. But I would search high and low to make sure that you're not missing some x-ray table that might be out there.
Yeah, and perhaps work with somebody, manufacturer of other types of x-ray tables to see if that's something that they can start making.
Exactly.
Okay, so Jan, are you aware of anything specific that's being done to train medical students and doctors on the requirements of the ADA and the need to have wheelchair accessible offices and equipment? For example, are they being trained on common disabilities that might require the use of a wheelchair?
Sadly, I think that it's very rare to find any medical schools or students that actually understand about the ADA and are training their students in accessibility and modification and effective communication requirements. I think it's very, very unusual to actually train those medical students. I think it would be so helpful to be able to do that. I know I've participated in a couple of at least classes where we talk to nursing students about disability and different types of disabilities and what they need to be aware of. But it would be so incredibly helpful to do that. And we've tried to encourage medical schools to open their curriculum up and add specific curriculum for how to interact with people with disabilities, because they often have not had that kind of training. They're at a loss when somebody with a disability comes to them. Some of them may want to provide the best service possible, but they don't know what to do. And so it really, really would help if they provided, medical schools would provide that kind of training. And if continuing medical education would also provide that kind of training for doctors that are already out there practicing. So that's my pitch for that to happen. I know Stanford University is doing some work around disability and medicine. And there may be other schools out there, and people could tell us if they know of that. But my understanding is I have not heard of a formal medical school curriculum or a continuing medical education program that includes disability awareness and a little bit of at least ADA basics.
Jan, I'm going to jump in here for a moment. I'm happy to tell you that the Southeast ADA Center, in collaboration with its affiliate at Georgia State University, the Center for Leadership and Disability, is working on an online course. Its working title is Nurses and the Americans with Disabilities Act. And so as soon as we have that ready for launch, we'll be sharing it widely. So that will be that it's at least a start.
That's excellent. I'm really glad to hear that, Pam. Thank you for sharing that.
All right, Jan, it seems like we need some clarification on when an entity has to meet these medical diagnostic equipment standards. So can you distinguish between private providers that receive federal funding versus a Title II or a state or local government entity?
Well, and of course, as Nancy said, 504, which is when you receive federal financial assistance, those regulations from the Department of Health and Human Services, most medical providers, I don't know a percentage, but probably over 90% receive some sort of federal funding, because remember, that could be Medicare, that could be Medicaid, that could be other forms of federal financial assistance. And so the Department of Health and Human Services in their 504 regulations has also requirements about medical diagnostic equipment. And I think those need to be, I honestly would have to look back to see when the start date of those, but they already may be required, to be in place. And then if you're, again, an entity covered under ADA Title II, that's a state or local government, you have obligations that already are in place, is my understanding, to be able to have that medical diagnostic equipment. And then, of course, if you're a private provider, if you get that federal financial assistance, that's what 504 would require you to do. If you are absolutely receiving no federal financial assistance and you're a purely private medical facility, you may not have those requirements, but remember that you still have the requirement to make reasonable modifications of policy, practice, and procedure. And so you still need to be able to make sure that people with disabilities can receive those medical services and, whenever possible, transfer onto medical equipment and receive the examinations and other medical services.
Great. All right, well, that does it for the medical setting related questions that we received. We did get some other questions related to other environments, school, courts, employers, things like that. So I'll just use this opportunity to remind everyone to please contact your local ADA center with those follow-up questions. 1-800-949-4232, or you can find your local center at adata.org. And someone at that local center will be more than happy to answer those questions related to other settings. So with that, I'll turn it back over to Pam and thank everyone for all of the great questions in the chat.
Right. All right, Emily, thank you. And I also want to give a huge applause to Maggie, Jan, and Nancy for all of their excellent information today. And I want to echo what Emily said about our questioners. Our audience has asked excellent questions. Again, just as a reminder, so if you have questions that were not answered today or were not about healthcare, please do contact your regional ADA center at 1-800-949-4232. And you will receive an email with a link to the online session evaluation. We ask that you please complete the evaluation, as we do value your input and look at the information to plan for future webinars. Again, we want to thank our speakers today for sharing their time and knowledge with us, and we will thank you for attending today's session. Have a great day.